Today's video is about breast cancer. Hey guys, welcome back to my channel. I know it's been a while, guys. I know it's been a very long while, but I'll tell you guys all about that in a story time coming up. So if you're new here, welcome. Make sure you hit that subscribe button, like, comment, and share. Tell your friends, your family, everybody to subscribe. I am ShaneGreen and welcome to the family. So guys, you know, October is celebrated as Breast Cancer Awareness Month, and I know this topic is near and dear to my heart, so I thought it was fitting for me to talk about it, talk about some of the causes, some of the treatment options associated with breast cancer. This is just a disclaimer, guys. I am not a doctor, I am not a medical student. This is just information based on research. I've used credible sources, so the information is accurate, so you can trust it, guys. Not a doctor though. So guys, what exactly is breast cancer? Breast cancer is a type of cancer that starts in the breast tissue. It can start in one or both breasts. Cancer starts when the cells begin to grow out of control. Many different things can affect your chances of getting breast cancer. However, there is no single cause. Breast cancer results from a combination of the way we live our lives, our environment, and our genes. And yes, I said or we, because yes, men can get breast cancer too. However, there are quite a number of risk factors associated with breast cancer. Research shows that getting older is the most significant risk factor associated with developing breast cancer. The main reason for this is the fact that over 80% of breast cancers happen in women who are over the age of 50 and who have been through menopause. So this is why it is recommended that women who are between the ages of 50 to 70 years old get screened for breast cancer every 3 years. And interestingly, most men who get breast cancer are usually over 60 years old. Having someone in your family with breast cancer doesn't automatically mean you are at risk for developing breast cancer. However, a small percentage of men and women have an increased risk for developing breast cancer if they have a significant family history. But because breast cancer is the most common cancer in women, it is possible that it occur in more than one family member at a time by chance. Research shows that most cases of breast cancer do not run in families, but genes known as BRCA1 and BRCA2 can increase your risk of developing both breast and ovarian cancer. You may be more at risk for developing breast cancer if you are overweight and have experienced menopause. So the main reason for this is thought to be linked to the estrogen in your body, given that being overweight after menopause causes more estrogen to be produced. But you can reduce your risk by maintaining a healthy weight. Research shows that if you have previously had breast cancer, you're at a higher risk for developing it again, either in the same breast or the other. However, a benign breast lump does not mean you have breast cancer, but certain types of breast lumps may slightly increase your risk of developing cancer. Your breasts are made up of thousands of small glands or lobules that produce milk. This glandular tissue contains a higher concentration of breast cells than other breast tissue, making it denser. What this means is that women with dense breast tissue have a higher risk of developing breast cancer, given that there are more cells that can become cancerous. So, the female hormone, estrogen, can sometimes stimulate breast cancer cells and cause them to grow. The ovaries, where your eggs are stored, begin to produce estrogen when you start puberty to regulate your periods. Your risk of developing breast cancer may rise slightly with the amount of estrogen your body is exposed to. For example, if you start having periods at a young age and experience menopause later than average, you will have been exposed to estrogen over a longer period of time. In the same way, not having children or having children later in life may slightly increase your risk of developing breast cancer because your exposure to estrogen has not been interrupted by pregnancy. Hormone replacement therapy is associated with an increased risk of developing breast cancer. There is no increased risk of breast cancer if you take hormone replacement therapy for less than 1 year. But if you take hormone replacement therapy for longer than 1 year, you have a higher risk of breast cancer than women who never use hormone replacement therapy. Research shows that women who take the contraceptive pill have a slightly increased risk of developing breast cancer. However, the risk starts to decrease once you stop taking the pill, and your risk of breast cancer is back to normal 10 years after stopping. Certain medical procedures that use radiation, like CT scans or X-rays, may slightly increase your risk of developing breast cancer. Drinking alcohol may slightly increase your risk of getting breast cancer. The more alcohol you drink, the more your risk of getting breast cancer increases. So guys, let's do a recap of the 10 risk factors associated with getting breast cancer. So 1, we have age. 2, a family history of breast cancer. 3, being overweight. 4, previous breast cancer or lump. 5, dense breast tissue. 6, exposure to estrogen. 7, hormone replacement therapy. 8, contraceptive pill. 9, radiation. 10, alcohol. I hope you guys found this video interesting, and I hope it provided information that you needed. And don't forget to like, comment, share, and subscribe, guys. Tell a friend to tell a friend to tell a friend to subscribe.